A good health insurance and accident insurance are always recommended in any country. Often when you're faced with illness or an accident, you may end up with high costs. In this video, I explain why it's essential to have proper insurance when coming to Thailand. First, let's talk about healthcare in Thailand. It is exceptionally good, with some people even traveling to Thailand for medical treatments, known as medical tourism. There's even a separate visa for medical stays in Thailand. Last year, 2.5 million people came to Thailand for medical treatment. Medical treatments are also very affordable here compared to other countries. The doctors are well trained and many have studied or worked in the West. Their knowledge is up to date and hospitals have the latest equipment for various examinations. There are two types of hospitals, private clinics and state hospitals. I have had enough experience with hospitals after our move to Thailand. I've had 2 accidents and both times I was taken to a hospital by an ambulance and operated on for broken bones. I also received treatment at a hospital's outpatient clinic for a frozen shoulder. We chose Bangkok Hospital in Rayong for our healthcare because everyone there, including doctors, nurses, parking attendants, and administration, speaks English. This is very important in a hospital where it's crucial to explain what's wrong and understand what the doctor is saying. Furthermore, I had previous experience with the outpatient clinic of this hospital. After my car accident, I was taken to a state hospital. No one there spoke English and it was challenging to communicate what was wrong. After a few hours in this hospital, I decided to go back to Bangkok Hospital. First, let's talk about visiting an outpatient clinic. You can get an appointment with a doctor quickly, usually within a few days or even immediately. You don't have to wait for weeks or months for an appointment as in Western countries. When you enter the hospital, you're immediately asked if you have an appointment and whether you want to pay yourself or through insurance. You will be registered and you need to show your passport and insurance papers. It's also wise to always have your passport and insurance card with you in Thailand. A copy of your passport for identification is sufficient. You don't need to carry your actual passport everywhere. After registration, your blood pressure, heart rate and temperature are measured in the department, and then you wait in comfortable chairs to see the doctor. There are many nurses around and it's not always clear what they are doing. When it's your turn, you'll be called, and if any tests or examinations are required, you'll be taken there. After the consultation, if you are paying for it yourself, you'll be taken to the cashier. We have to do this because we have inpatient insurance only, so we have to pay for outpatient services ourselves. Even in an expensive hospital like Bangkok Hospital, a consultation typically costs only 40 to 60 euros on average. If you've had an accident and need medical assistance, an ambulance will be sent. It's notable that 5 to 6 people come out of the ambulance. In any case, there is always a trauma doctor present. The driver rushes to the emergency room in a Thai manner, so you get there quickly. After an assessment in the emergency room, if you need further treatment, you'll be taken to your room. Foreign patients with insurance are always placed in a private room, not in a hospital ward with other patients. During my hospital stays, I noticed that the nursing staff began their rounds at 2 a.m. So to get enough sleep, I had to go to bed early in the evening. At first, I was given only Western food until I made it clear that I preferred Thai food. In Thailand, it is common for a family member to care for the patient when they are in the hospital, helping with meals, etc. That family member also stays in the hospital. In my case, my husband went home every evening at first and returned at the end of the morning, so I had no help with breakfast. It was set up next to my bed, but I couldn't reach it and couldn't remove the foil. I also couldn't make coffee in the morning because I was in bed and couldn't walk. The nurses noticed this, and after a few days they began helping me with breakfast and coffee. After that, we decided that my husband would always be present to help me with meals and such. He also stayed in the hospital during the last few nights. Then comes the day when the doctor says you can go home. The entire process is set in motion. You receive final tips for home. Medications are prepared for home, and importantly, the hospital prepares the final bill and asks your insurance for approval to pay this bill. For someone with Thai health insurance, this takes 1 to 3 hours. Only after the hospital receives confirmation that the bill will be paid can you leave the hospital. That's why it's so important to be insured or be able to pay the bill yourself. There are many stories of foreigners being unable to leave the hospital until their family back home paid the bill. I hope you've gained some valuable insights from this information. If you have any questions, please leave them as comments on this video. If you enjoyed this video, please subscribe to this channel. It's free and greatly helps me.